So thank you all for joining our monthly digital health interest group seminar. We've had a great run so far up to now, and we have a really exciting talk today concerning informatics education, especially for clinicians. I'm going to turn it over to the School of Health Professions, Dr. Alan Lewis, for the introduction.
Thank you, Dr. Berger. It really has been an insightful and informative series thus far, and we expect the same tonight. So tonight we have a treat. We have Dr. Mohammad Faysel, who is chair and associate professor of the medical informatics program here at SUNY Downstate in the School of Health Professions. Dr. Faysel has a very long list of accolades, so I'll just mention a few things tonight. He has over 15 years of experience in the academy in teaching and conducting research in the area of informatics. He is the recipient of the 2019 SUNY Chancellor's Award of Excellence in Teaching. Dr. Faysel was recently awarded the designation of Fellow of the American Medical Informatics Association. Approximately 1 year ago, Dr. Faysel was also elected to serve as a member of the Health Informatics Accreditation Council of the Commission on Accreditation for Health Informatics and Informatics Information Management Education Programs, where he'll serve for a 3-year term. He's very knowledgeable. He is an expert in his field, and we'll have a great discussion tonight under his leadership. And without further ado, let me turn it over to Dr. Faysel.
Thank you, Dean Lewis. Thank you, Dr. Berger. Thank you for the opportunity to give me the opportunity to present tonight. Once again, thank you for joining us today for this Digital Health Lecture Series 1-1, hosted by Dr. David Berger and his team. So tonight I'm going to talk about digital health informatics. Basically, you cannot separate them, in other words. So specifically the education and credentialing opportunities for health professionals. So the all spectrum of health professionals. So I'll try to sum up some of the credentialing that are endorsed by nationwide, the national level professional organizations, and then educational opportunities available. Also, I will try to end with, if time permits, maybe a slide or maybe a little bit of time to talk about what is available at Downstate as well in terms of educational opportunities for the health professionals here. So I'm not going to cover any definition here. I think we had a really, really excellent first presentation by Dr. Stan Kachnowski. That was really great, actually. He covered all aspects of definition that is needed to explain this field. So I'm not going to cover this, and I have seen this. This is available at Downstate YouTube television channel. I'm not going to cover any definition, so rather I'll jump into the academic, educational, and then credentialing opportunities available, and then also I'll try to conclude with what is available at Downstate for our healthcare professionals here. So why training and education in digital health and digital health and informatics matter? Because the end goal is basically to emphasize on technology as an integral tool to ensure timely delivery of much needed healthcare services. So technology has been an integral tool, as you know, these days patients also demand from their end too, so to access information. So access to care is a big problem right now, especially for the rural areas, also for some of the low resource healthcare facilities. So therefore, it is very important, and then it is much needed one right now. So the ultimate goal for all of these is to improve the human health through the technology. So why education, training, and credentialing again? The National Academy of Medicine, which was formerly known as Institute of Medicine, had a report in 2013 where they outlined 5 core competencies for health professionals. The first one is working as a part of interprofessional teams, then delivering patient-centered care, then practicing evidence-based medicine, then focusing on quality improvement, and last not the least, using information technology. Although you may think about information technology is very simple, but the term is broad, especially these days. That includes all sort of technologies we talk about, wearables, mobile devices, and all of these. So competency in this area is much needed. wide training and credentialing again and education, advancement in technology-oriented healthcare delivery. We have that. Now we have been seeing a rapid adoption of digital health technologies, but the knowledge gaps and the gaps in knowledge and skill in workforce, especially in healthcare workforce, is still there. So, for example, a study by HIMSS, Healthcare Information Management and System Societies, have shown that because of the aging workforce in healthcare, there is a huge gap in knowledge and skills. So one of the studies showed average age for nursing faculty, for example, who are training the next generation of nursing folks is above 60 years. So it's between 60 and 62. But by the time they were trained, so this kind of informatics and technology-oriented training in nursing curriculum was not there. So there is a gap. So it's kind of lacking the train the trainer kind of thing. So we really have to have the educated, well-trained healthcare workforce. Shortage of well-trained and skilled informatics professionals. These have been constantly documented from the job posting. So many of the job stays unfilled, especially in the informatics and digital health area for a longer period of time. One of the examples actually documented by Crane, they reported that on an average, an informatics related job stays open nationwide 34 days, especially in New York City areas, it was 40 days. So it's longer than the national average. The one reason is there is a lack of well-trained and skilled informatics professionals. Healthcare workforce. So the workforce is not well equipped for the ever evolving digital health challenges, especially for the rural areas and low resource healthcare facilities where budget is a problem. So they cannot have adequate budget for technologies. And then if they have the technology, then they probably won't be able to train the workforce to manage those technologies. And oftentimes they have to rely on third parties. So there is a lack of well-equipped healthcare workforce to mitigate those challenges. Employers these days tend to demand higher credentials. So if you see job openings, you will see there's a long list there. I know when I went to college many years ago, we were in that environment that if you sign up for a job, tech-related job, they would give you a sign-in bonus, also a training for a year or so, but that has changed. These days, employers tend to know that whether the person is job ready. In other words, they can take the responsibility immediately without much of the training. So that's been growing. And recently, actually, I was reading the job openings from the VA. They're looking for a CMIO. That was shared from my professional organization, American Medical Informatics Association. There was a long list, but in the middle somewhere, there is a list. It says certification is in informatics. That's required. So you will see more and more jobs, and you probably have seen that requires that skill set, that requires that kind of training, that to validate that the person has some kind of training in informatics so that they're familiar with the informatics activities as well, or at least they can manage them. And then recent pandemic has taught us lessons. We had to rapidly adopt digital health technologies without even having properly trained workforce. Also, many facilities, they had problems because of remote access to information without properly securing their devices and connections. So there is a rise in cybersecurity activities, especially in targeting low resource healthcare facilities as well. It's on the rise. Actually, recently there was an international report, survey report published by IBM, especially on the security incidents nationwide. So it was evident that the cybersecurity incidents were equally, actually, evenly rising throughout the globe, basically. Especially in healthcare, the target is the smaller and middle tier healthcare facilities where resource is scarce. To develop, implement, and manage meaningful digital health solutions to meet the needs of technology-oriented healthcare, as you know, more and more technologies are being developed to make sure the ease of access and also to address the digital divide these days. So therefore, there is a huge need for training and education, especially to train the workforce for these challenges. Emerging opportunities for building new career paths, especially for health professionals. So these days we have seen, actually we are seeing new job roles. Those are emerging, those were previously not there, or repackaging of existing job roles. For example, Chief Digital Health Strategist, Director of Digital Health Equity. I have seen somewhere, actually, I don't remember exactly where, but it's a digital health doctor. So we have been seeing this digital health, this and that, those kind of roles are emerging, actually, it's growing. And these are much needed ones. And there is a projected job growth of 28% annually for the at least next 5 years. So there is a huge demand there, huge opportunities there. There is a huge need also for this training and credentialing. So this health informatics professional career matrix, this was actually prepared by the folks from Canada, the Digital Health Canada group. I thought it would be interesting to share with you rather than developing some kind of matrix myself. This is very interesting. This covers all sort of informatics roles that one can play within healthcare facility. Some of the job roles you might see it, even if it says Canadian health system domain, for example, the second column, but they're equally actually important for the United States healthcare setting as well. So let's look at the first column, the ones I actually highlighted with the red border there, especially for the clinical settings. So it starts from the bottom, as you can see, emerging professional level. So that's the kind of an entry level, clinical informatics coordinator. Then second level is competent level, which is clinical informatics analyst. Then the proficient level, clinical informatics manager. Then the other role could be clinical informatics specialist. Expert level, clinical informatics director. Also, there are new roles these days. We have seen Chief Nursing Informatics Officer. Then the master's level is, Chief Clinical Information Officer, or equivalent. Other one is Chief Medical Information Officer. CNIO, or the Chief Nursing Informatics Officer, could be part of that as well. And the other roles, as you can see, we have seen from our experience, from our graduates, as well as nationwide surveys, graduates from informatics programs with healthcare background, they also pursue the other career opportunities here listed under different columns, as you can see. So this is a comprehensive matrix that covers all sort of informatics career roles one can play, actually. So each of these, you see, they require a unique set of skill sets and a well understanding of the jobs, the task requires. Informatics skills are needed, knowledge and skills. So therefore, they require some sort of training. So to address this, what are the educational opportunities available for health professionals? So let's talk about this, and then I'll share with you latest credentialing opportunities with the requirements for clinicians, non-clinicians, and other healthcare practitioners as well, who are involved in healthcare facilities. So what are the educational opportunities available for health professionals? One is degrees in informatics. So it could be any areas in informatics. Usually master's is something is expected for informatics roles based on the job analysis, based on the minimum requirement for credentialing, and then so on. So there are various opportunities of degrees, actually, to pursue a degree in informatics available. For example, master's degree is the most common one, then a Ph.D. in biomedical informatics, health informatics, however you call it. So these are the umbrella terms. Digital health informatics, this is a new term some of the programs are using these days. They're adopting this new term. The other way to think about DHI is Doctor of Health Informatics. So this is a very new trend. We are seeing some of the programs are coming up with professional doctorate in health informatics. Full-time versus part-time. And then at the same time, online versus in-person. So there are many programs available. You could pursue it full-time, you could pursue it part-time, but some of them are research intensive. So those require full-time commitment. But others are part-time, which can be completed on a part-time basis, for example, taking a course or two, evening time, for example, online programs, sometimes in person for demonstration and so on. So there are various opportunities. Depth of knowledge is covered in these programs. When you committed to a degree program, so the depth of knowledge matters there, right? It required technical and informatics skills. You could develop those through the completion of a degree program. Higher reward, potential job role changing. So sometimes people want to shift their career or the job role gear a little bit because of financial reward there. Potential career changing or promotion opportunity. Example is a higher salary for a different role, but within the same healthcare environment, maybe within the same department even. Added informatics, responsibility to the existing role. Long-term career building opportunity, because informatics provides a career building opportunity that requires some sort of training. Now, the second opportunity, or the second category of opportunity, I should say, certificate and certification. So there is a difference between those. One requires the certification. For example, you have to complete a set of, series of courses, for example, and other requirements from a program. On the other side, some of the certificate programs they have, you could complete a course, you could complete 3 courses or 5 courses, something like that. But people are using them interchangeably, but I found out some programs differentiate them within their program brochures and others contents. Shorter completion time, as opposed to the degree program, may not have in-depth coverage of subject matter. So for example, may not cover all aspects of informatics that is expected of a master, for example, compared to a master's degree program. Suitable for someone who wants to explore the field or to add technical skill to their credential. So quickly, completing some short-term training program or certificate courses or certificate program, and then adding to their resume, basically boosting their resume. Or if someone wants to learn about the field before committing to a full-blown degree program, for example, to a master's degree program. Sometimes people health professionals do complete this short-term training to add to already established accolades they have. Another option is short courses. So these short courses are short, meaning really short. They have certain number of meetings, for example, hours, maybe 15 hours per week or for 2 weeks, 3 weeks, or sometimes boot camp or something like that, very short. So for example, our professional organization, American Medical Informatics Association, offers what we call a 10 by 10 course on specific areas, specific topics of informatics. So it's a list of them. Those are available on the American Medical Informatics Association's website. Some of them do cover also continuing medical education credit as well. So these are to learn about a specific area of the field or to learn about a tool, for example. Sometimes to prepare for credential exam, for example, clinical informatics board exam, our professional organization offers review courses, short-term review courses that also offer continuing medical education credit as well. Also, there are other options. So for example, executive training for leadership, especially mostly focused on management, operations, and overall financial aspect of digital health. This number is growing actually. The number of these kind of trainings are growing, especially meant for high-level executives and the leadership. So you probably will see, or you probably have seen, many of the universities are offering this kind of leadership training program in digital health. So those are the educational opportunities if one wants to go through the training, taking courses and so on, training through courses and programs. Now, what are the credentialing opportunities for health professionals? To validate one's competence, right? Or their expertise or their ability. There are some credentialing opportunities. There are a good number, you will find online, but not most of them are validated or endorsed by the nationwide or national level or international level professional organizations. So for example, here are first two and then the number third, those three, these are all validated, sponsored, and somewhat administered, I should say, or collaborated by the professional organization in the respective informatics areas. For example, the first one is a brand new one, very new one, American Medical Informatics Association Certified Health Informatics Professional Credentialing. So the first exam, I believe they had it this month or they're going to have it soon. Supposed to be in last fall, or maybe they started in last fall. So this is the brand new one. It was administered for the first time, I believe. So it's open for all, as long as they meet the minimum requirement. It could be health professionals, MDs, RNs, all of them, but the minimum requirement is some kind of, I think, I'll share with you the requirement, some sort of informatics experience, work experience or so, and then educational requirements, for example, a master's or PhD degree and something like that. This is open for all, but specifically targeting the health professionals because it requires a master's degree also. The second one is board certified clinical informatics. This is, as you know, clinical informatics is a subspecialty right now. It's part of the, I think, administered by the American Board of Preventive Medicine. So it's a subspecialty. So you will see if you go to their website, one of the subspecialty categories there. So there is a board exam for that. These are only for the MDs, the MDs who have active medical license, and then with some requirement there. So right now there is a pathway, meaning anyone can sit with an MD degree with some practicing, requirement met. So basically, for example, 20% of their work experience or work responsibilities related to informatics or something like that. I'll show you the full requirement there, and then the website, the web address is here. If you're interested, you can learn more from their website too. Then the other one, the third one, this is for the nursing. So informatics nursing certification, it's called RN-BC. So that's the credential they have. It is through the American Nurses Credentialing Center. So ANCC, the website is there. I'll also go through the requirement for them as well. So these are the three. There are many others. So these are the major three. I'll be talking about it a little more because these are all endorsed by and then also coordinated by the professional organizations. And these are widely accepted right now. So let's talk about the AHIC. The first one, credentialing opportunities for health professionals. Through the AHIC, Emea Certified Health Informatics certification, basically, that's the name. So what are the eligibility criteria? First one, academic degree, a master's or doctoral degree in health informatics or degree with a focus in informatics from an accredited program, college or university. And then there are some examples, as you can see there. It could be in any area or a generalized health informatics, biomedical informatics, whatever you call it, as long as it is a master's level informatics or related degree program, that suffices. And what are the related required work experience? So required work experience, as you can see, the first one is 50% to 100% of their job responsibility must be within informatics. And then that must be 4 years within the last 6 years. And then the other option there is 20% to 49% of the responsibility must be within the informatics, health informatics. That must be done within the 6 years, 6 years within the past 8 years. So within last 8 years, as long as they have 6 years of experience in informatics, for 20% to 49%, they will be eligible. The second option is a master's or doctoral degree in health informatics related field from an accredited program, college or university. So example is there again, dentistry, medicine, so MD degrees, those DMDs, all of them, nursing degrees, all of them, they're related to health informatics. We consider them related to health informatics, of course. Completion of that will suffice the academic degree requirement. So MDs, RNs with a master's, degree, public health practitioners, for example, computer scientists, as long as they have a master's degree or MD or equivalent, they are eligible to sit for this exam. The same thing, the work requirement here is 50 to 100% of their work experience or work responsibility must be within health informatics. So 6 years within the past 8 years. It is similar to the previous one, but it's a little more, I would say. compared to the first option. Then if they have between 20 and 49% of the work responsibilities in health informatics, then they must have it for 8 years within the past 10 years. So as you can see here, a master's degree in informatics or related field, that suffices. So in other words, if you have a master's degree or equivalent, or a terminal doctoral degree, or a professional doctorate degree, that will suffice the academic requirement. So only variation is in the time spent in informatics. So as you can see, whichever fits your criteria, whichever fits your experience, and if you're interested in learning more, you could learn more about how to document them. Even those are all available on the website of Emea. So the link I have there, I will try to share that in the chat box also toward the end of the presentation. So this is about the AHIC, Emea, or American Medical Informatics Association Certified Health Informatics Certification. So there are various ways to, one thing I should say, there are various ways to document this health informatics work. Your job responsibilities may not directly say you are performing something that is informatics, right? So you have to document it in many ways. For example, a letter from the supervisor or someone like that. And many other options are available to document the work experience requirement for this AHIC credentialing certification exam. This was meant for, as you can see, a master's degree, at least a managerial level or more, level of roles, not really entry level. So Emea is currently working on more credentialing for entry level professionals as well. So I don't know if you can see this, probably hard to see, but I'll share with you briefly what are the requirements. So this is the second requirement. This is the second one, I'm sorry, for the board exam. So clinical informatics board exam, these are the requirements. First thing, the pathway. So pathway is basically documented through the activities or experience in informatics. It is open until end of this year, 2022. After that, meaning from 2023, to be eligible for this certification exam, to sit for the certification exam, one must have a 2-year fellowship after completing residency in clinical informatics. So they must have 2 years of residency. Many of the academic health centers, they already started the clinical informatics fellowship, already started because that suffices this requirement. So they have to have at least 2 years of fellowship completed in clinical informatics after their completion of residency in one of the medical subspecialty. Now, what are the requirements for practice pathway right now? So this option is for the practice pathway, the 3 years of at least 25% of the time in the 5-year period preceding June of the application year. So this is the last year one can apply for this or sit for this credentialing exam under the practice pathway option. If one already has an accredited fellowship completed, 24 months at least, they will be eligible. So they don't have to have this work 25% of the work requirements in informatics. One must have board certification. Current ABMS board certification is required to sit for this exam, or AB PATH, I think is the American Board of Pathology. Either one is okay. So either one suffices. What are the academic requirement or educational requirement? So the first pathway purpose, that option applies to physicians who have completed an accepted master's or Ph.D. in biomedical informatics. So that will suffice. For the, of course, they have to have the board certification as well. But if one is completing the fellowship, 2-year clinical informatics fellowship, they don't have to have this master's degree. Why is that? Because through the fellowship, the clinical informatics fellowship program, many of the organizations, the academic health centers, they're already integrating the graduate level informatics curriculum in the fellowship program. So they will be covering this graduate level coursework or informatics educational component in the fellowship program. So that will fulfill the requirement. For the practice pathway, what are the practice activities required? So 36 months is the minimum requirement and be at least 25% of their time, basically 10 hours per week in informatics activities. So these are the requirements, as you can see, but completing a master's degree, that helps. As you can see here, either way, if you're going through a fellowship, you will probably see the fellowship covers at least a master's degree or some kind of certification in informatics. So master's degree, I would say, based on the requirement, is probably the widely acceptable educational component here to be eligible to sit for this requirement. And one more time, this pathway, clinical practice pathway, is open until the end of this year. From 2023 on, one must complete a 2-year post-residency fellowship in clinical informatics from an acceptable program to be eligible to sit for this credentialing. So more about the clinical certified board certified clinical informatics. Why is that? Because according to American Medical Informatics, you can find this information on the website as well. Who's the main sponsor of this clinical certified board certified clinical informatics? There are only 1,800 board certified clinical informatics clinicians who had this credential so far. Actually, they passed this credentialing exam. Fortunately, actually, I am proud to say that some of our, actually at least 2 to 3 of our alumni, they sat for this credentialing exam, who were practicing MDs and also graduate of our program. They sat for this exam and then they passed this exam in one sitting. So they didn't have to repeat it. So that's a good thing I just wanted to share with you. But there's a huge need for this kind of credentialing. Why is that? Because it's a more validated one, I would say. Anticipated need for at least 6,000 of such credentialed practitioners because we have 5,000 hospitals and then 20,000 of clinics. So they need some sort of experts in clinical informatics who are also practicing MDs too. By the way, as I mentioned, the prep courses are available from American Medical Informatics Association. So once again, this board certified clinical informatics credential is available only for the practicing MDs. And there are 2 pathways, as I mentioned, 2 ways to sit for this exam. If you're interested in learning more, please visit the website. Here's the website. If you're interested in learning more about the curriculum, we have also how our alumni prepared themselves. I can connect you with them. Just let me know. You can send me an email. I will be happy to share with you their contact information, of course, with their permission. So this is the 3rd credentialing for nurses. This is only for nurses. As you see, the first one, AHIC, is meant for all health professionals or related field. As long as they have that minimum requirement, they're eligible to sit for that. And by the way, the AHIC one is valid for 4 years. And then clinical board exam, I believe it's probably 5 or 10 years. I'm not sure. I have to double check. But it should be on the website of ABPM. This one, this American Nursing credentialing one, this one from the ANCC, actually, nursing informatics nursing certification. This is only for restricted for this is only limited for the practicing nurses. So they must have an RN with the license, active license, and they must have, as you can see here, minimum bachelor's degree, but then with added requirements for 2,000 hours of informatics nursing activities within the last 3 years, or 1,000 hours of nursing activities, of course, in addition to some of the education requirements. As you can see, they have to have completed at least 30 hours of continuing education of informatics for, within the last 3 years, or they have to have, as you can see, the other requirements. So I want to focus on one thing here. The second requirement is there, meet one of the following practice hours requirements. So this is a must for them. Either they have 2,000 hours in informatics nursing within the last 3 years, or they have practiced a minimum of 1,000 hours in informatics nursing in the last 3 years and completed a minimum of 12 semester hours of academic crediting in informatics courses. So it's basically, as you can see, it's graduate level informatics nursing courses, or have completed a graduate programming in informatics nursing. So even if you see it says informatics nursing, any health informatics program that are accredited or offered in the United States, I believe they also fulfill the requirements. So there is no separate requirement for that. As long as you have an informatics degree, master's level degree, that will suffice. I know for sure our program suffices because we have graduates who sat for this credentialing and then they were able to pass this exam and they have this credential. So as you can see, these are the requirements. So these are the major three credentialing options available for health professional. Of course, this is the last one. The ANCC one is for nurses. The other one, the clinical board certification of clinical informatics for the practicing MDs. And then the first one, the AHIC one, as I mentioned, the Emea certified health informatics professionals certification, that is open for all, anyone, MDs, RNs, other health professionals, for example, therapists, you name it. As long as you have a master's degree, I think that's safe to say that you will be eligible to sit for that exam with some years of experience. So a percentage of your responsibilities, as long as they fulfill the health informatics requirement, work requirement there. So these are the major three. Now, other options available there. One is from Health Information Management Systems and Society. As you know, this is another trade kind of professional organization. It's a huge organization, actually. So the vendors, all the latest and greatest technologies you see, all the big name vendors, for example, Epic, Allscripts, all of these, Cerner, you name it, they're all part of this HIMSS organization as well. So our program here is also an affiliate, academic affiliate of HIMSS organization. So as part of this, our student can access resources and then they can have review materials for these credential exams and then access these resources as well. So what are the credentialing ones, exams available through HIMSS? So there are many, there are a couple of them, I should say, not many, but these two are widely known. One is CA HIMSS. This is meant for the entry-level professional. The other one is CP HIMSS, which requires, I believe, at least 5 years of work experience in health IT. There are new digital health certifications that are emerging. You will see, as I mentioned earlier, from various universities, institutions, and highly specific health professional organizations, or maybe specialized, I should say, specific professional groups. And we will probably continue to see the emergence of this kind of credentialing. For example, the executive leadership credentialing for digital health, or in digital health and something like that. I think I heard someone actually discussing it, but I don't have the accurate information when and where it will be officially available, but these are in discussion among the members and the decision makers of professional organizations. So I would like to just share with you a few things. What is available here at Downstate for our health professionals? For anyone, it doesn't have to be Downstate employee or so, you know, as long as you're interested in, I think this is something would be helpful for you to know. So opportunities for residents, fellows, College of Medicine students, faculty, staff, or other IT or health professionals at Downstate or outside. We have a 39 credit hour master's in informatics, actually master's in medical informatics program here at Downstate. This program is very flexible. It can be completed on a part-time or full-time basis, evening-only classes. Each class meets once a week, basically 6 o'clock after work. It works really well, and many of our Downstate colleagues, actually, they have completed this program, and some of them are still enrolled in the program. We are currently working on a high-flex option where we will be able to offer online and our hybrid, format of offering this curriculum. Actually, we are right now working on a curriculum change application. So as long as we have the approval from the state, we should be able to offer this online. Should be soon, hoping for soon, actually. Small class size, hands-on approach, opportunities for student research. We have clinical internship, regardless of the background of students. We actually place our student to complete a clinical internship. We administer our own clinical internship. We have a dedicated clinical coordinator who oversees the program, and then we place our students. So unlike many programs nationwide where students have to find their placement, we have a relationship and affiliation with hospitals and other healthcare facilities throughout New York City and Long Island. We place our own students, so students do not have to find their placement. Possible scholarships and tuition reimbursement for eligible individuals who are part of the UUP members at Downstate. Options for non-matriculated students. Basically, what it is basically you could just take a course and then see how it goes. If you decide you can come back to the program, or if you might have a specific need to fulfill the educational requirement, as I mentioned, for the credentialing exam. So you want to take a course or a couple of courses to meet that requirement, you could do that here as well. Independent research studies for faculty, students, and others. Varieties in course. So we have actually a wide range of course we'll be offering. Most affordable programming in the nation. We were actually ranked #1 in terms of the affordability and the value of the program 3 years in a row. So this is the last slide I have. I just wanted to mention one thing. The reason I did that is I have actually received many emails from our residents, practitioners here, junior faculty, the ones going through some kind of fellowship, that is there any option to take a course or two or do an independent project? So considering all of these requests, actually, we recently opened this non-matriculated option. So only a selected number of courses can be taken with the permission of the program chair. Once someone decided to come to the program, if they get accepted, those credits they complete, those courses can be transferred towards the degree completion of the program. Informatics project, as I mentioned, can be completed as an independent study. We just opened a new course called Independent Study, where one can actually just register for the course and then complete a project, of course, guided by the faculties. So these are the opportunities here at Downstate. With that, I would like to invite you to join us for our monthly information session. If you want to learn more about our program, here's our contact information. It's easy to find us. Here's our website information on the Downstate website. If you have any question, please feel free to send us an email. And all of us are online, listed website. Feel free to reach out to me directly, and then I'll connect you to the right person, or I'll try my best to answer your question. If you need any information from the professional organization, I can do the same thing. I can connect you to the right person there as well. So with that, I'll conclude my presentation today. But before that, just wanted to make sure you know how to register for the information session. If you go to our website, there are links that will take you to admissions website where all of the information sessions, monthly information session with registration link, those are listed. So it's easy to register for one of these information sessions where you can be able to talk to us actually on a one-on-one basis. I will conclude my presentation here and then I'm open the floor for Q&A.
Well,
unless Dr. Barger has something for me or the audience.
So Mohammad, thank you for that very informative presentation. One of the things that I learned that I wasn't aware of was that the National Academy of Medicine now has using information technology as one of its core competencies for health professionals. And that really shows how important this subject is. The other thing is, I hope that the people online realized how much in demand people with digital health and informatics skills are. And it really enhances your competitiveness as a health professional when you're applying for any position. And one of the things I've been trying to do within the hospital and the health system is bring on people who have informatics as a skill. Chris, can we give Dr. Brunicardi the ability to comment?
You can talk.
Oh, hi. Good evening, everyone. Thank you, Dr. Berger. Dean Lewis and Professor Faysel, congratulations on your nationally renowned medical informatics program. This was an impressive lecture, an inspiring lecture on the importance of digital health and medical informatics. These are critically important for our faculty development, as well as that of the residents and fellows as well, and the medical students. So I look forward to working with both of you as we do curriculum reform for the medical students over the next several years and build into our curriculum these important programs in medical informatics. I'm happy to make an announcement to the faculty, residents, and students about the availability of the master's degree in informatics. So Professor Faysel, if you would send me that information, I'm happy to disperse it to the faculty, residents, and fellows, and medical students. Once again, congratulations on this important work, which sets the vision for digital health going forward, as well as medical informatics. Thank you.
Thank you, Dean Gunakari. I'll send you the information about the program. And I truly appreciate your support and all the kind words. And as I do the same for Dr. Berger as well, I truly appreciate the digital health lecture series you started. I think it's a good starting, and then I hope it will evolve over time and we'll continue to have this lecture series.
Any other comments or questions? I don't see anything on the chat right now. If not, I want to thank Mohammad for a great talk. Thank you, Dr. Lewis, for your presentation and your introduction of Dr. Faysel. And next month is our annual Patient Safety and Quality Day. It will be held March 16th as part of National Patient Safety Week. We have Dr. Siegel will be giving the keynote address. Dr. Siegel is the president of America's Essential Hospitals. It should be a great talk. We have over 60 posters that will be presented, and the prizes will be going out to the best presentations. So please look for the announcement. And last year we had over 300 people attend the keynote. So please make sure you distribute the information to your learners and to your faculty. And I look forward to seeing you on March 16th.